overall better than when I started coming in. 2 days ago, it was starting to tighten up a little bit, and so I
Mostly on the right side, wasn't it?
yep, yeah, same spot, same thing. So
How
I
long?
just decided I'd come in for another thing.
How long's the treatment lasting now? So,
2 weeks.
so a little bit longer than before.
Sure, yeah.
Okay. All right.
So I haven't. You prescribed some massage, but I haven't been yet. I found the time.
Let's have you go face down.
Okay.
All right. You off work today?
Yes.
Have you been sleeping a little bit better after your treatments?
I always sleep well.
You're a good sleeper?
Mm-hmm.
Okay, so right leg short about a good 1/2 inch. And goes shorter in this position. Left one goes a little bit further, so we have a misalignment down at the sacrum. All right, take a deep breath in. We're going to adjust right here. You'll feel the cable drop. False alarm. Okay, deep breath in and out. And again, and out. Good. Legs even in position 1 and 2.
That fix it?
No, we're almost there yet. You're about 1/8 off. Lay on this side.
I can't feel it. Anything moving.
Sometimes you get that kind of movement, and that's a really good question, actually, slash comment. Sometimes you get that cavitation in the joint, or that sound like you felt, that movement you felt there, and
Yeah, I
sometimes
felt
you
that
don't. Lay on your back for me. Take a deep breath. Release. Take a deep breath in. And release. Go face down. Good job. How's work been going?
Yeah, it's okay. I've been trying to stand more at my desk.
You did say you have a stand-up desk, correct? Yeah. Does that seem to help some of the shoulder, mid-back problem as well?
I think so, yeah, if I do it for, half of my day or whatever.
Did you complete your physical therapy portion as well?
Oh, with the foot?
Yep.
I stopped going because I've improved so much that I can just do it at the gym.
Are you healing from that?
Good, I'm running, sprinting 2 miles and no pain at all, so that's good.
Oh, you're up to 2? I thought you were doing more than that.
Yeah.
How long you been getting adjusted by a chiropractor?
This time, this is the 3rd time I've seen you. Last time I went maybe 8 times.
Yeah, but you were seeing someone else, right?
Right.
And how's the treatment that I'm doing different than the other doc?
I mean, it's different table, different technique.
Yeah, are you liking it?
Some of the movements are the same, some of them are different.
Do you feel like you're getting benefit by what we're doing?
Yeah, it was a more intense muscle spasm more frequently before I started coming in. I'd like to get to a point where I only come in, maybe every 6 months or so, if necessary.
Yeah, that's definitely doable. I mean, you can come in as little or as much as you want in that. It just depends on the kind of work that a person does, the kind of stress they're under, whether they sit at a computer a lot or, if they're out active. Go ahead, lay it on your back. seeing you, what, once every 2-3 weeks about?
Yes.
About every 3? And gently push your right ear into my hand right here. And slowly relax. Good. Now you're feeling mostly on the right side, correct?
All on the right side.
Okay. You're right-handed?
Yes. I have a separated left shoulder.
Wasn't it on the left side for a while too?
Yeah.
No, always your right side. All right, go ahead, sit up, face that way for me. So the scapula, the shoulder blade is starting to move more through here. So what I want you to do is just gently stretch that throughout the day.
I told you that's the side that like rubs on my ribs, right?
Yes.
Like plays the xylophone on my ribs.
Oh, you hear that?
It's pretty annoying. Yeah, I feel it. You know.
Even now?
Only sometimes.
When you move it around?
Yeah, you can right there.
That clicking?
Yeah.
Sometimes the ligaments or the tissue that's moving over there, that's just how you're built. Did this happen after the injury?
I only noticed it in maybe the past 2 years.
Increasing?
No, I don't know. I just one day I was like, oh, that's weird. Not associated with anything in particular. So.
Does it seem to go away when you get adjusted or reduce?
I'm not sure.
Okay. Well, let me know as we start to work.
It's not painful. It's just
annoying, probably.
I mean, yeah, and it only really does it when I put my shoulder in such the position to do it. Like everyday motions, it doesn't really. Sometimes at the gym I'll be like lifting weights and it'll do it, and other times it won't. So.
Well, based on what we saw on the x-ray, based on what you had happen to the shoulders, the amount of tension in there, it's not uncommon to have where some of that tissue starts to wear a little bit unevenly right between the shoulders, right where that area on the muscles are where we're working. So just let me know as we're working with each other if that reduces. When you have that curve or things are out of alignment, that pulls on the muscles.
Right.
But if you have certain like tendons or ligaments snapping over a bone, that's not something I'm going to necessarily like make disappear. Okay. Yeah. Any questions?
No.
You did good. Good job. Thank you. I appreciate it. Any last comments?